meant for students of the bachelor degree program in social work. In the first session, we shall be discussing about social welfare programs in India's 5-year plans. In PSWE 001, which is the first course in social work, in the second block, where we talk about the basics of social work, we have given 5 chapters or 5 units. The third unit is on social service and social welfare programs in 5-year plans. Now, this unit has been purposely incorporated into this particular block so that students who are getting introduced into the basics of social work will know the kind of efforts being made by the government of India and the various state governments in providing social welfare services to the people in our country. All of us know that since 1947 we are a free country, a democratic country. We have received our freedom, we have become independent. However, from time immemorial, welfare programs have been going on, whether under British rule or under the rule of various kings. But when the country has become independent, it has its own government and it has also established its own planning system. And so we have in India the Planning Commission, which makes the plans. And following many examples of advanced countries, India also adopted the 5-year plan system, in which the country plans for a long period of 5 years certain number of programs and sets targets to achieve those. Now, the very question is, what's the need for welfare programs? We do have both economic and social wants, certain requirements that remains unfulfilled. We need to improve the quality of life of people, what we call human resource development. Individuals do make efforts to achieve their goals, but the state has a responsibility to help the individuals so that they are able to reach some distance in their effort towards improving quality of life and services across the board. We have various sections of our society whom we call the weaker sections of the society, the disadvantaged sections of the society, people who need care and support. And we know that there are social problems, economic problems, physical problems, mental problems, and all these needs to be addressed. Now, if you look at the social problems alone, there is a wide variety of or groups of people who needs our care and attention, like the orphans, the widows, the mentally retarded, people living in the slums, women, children, and so on. Similarly, we have economically weaker sections, people living in remote villages, people living in the slum communities, people who are bonded laborers, rural artisans, street children, beggars. So there are many who are in need of help to mend their day-to-day life, to meet their own needs of day-to-day requirements. There's so much of inequality that exist in the society. We dream of a society where we can have equality, where people have the minimum that is required for a healthy, decent and dignified life. So the Planning Commission of the Government of India has experts, and in consultation with experts from across the country from various fields, they chalk out plans for the welfare of the people. So they identify certain important areas which needs to become the thrust areas. The first 5-year plan started in 1951, and so far we had about 10 of them. At the moment we are in the 10th 5-year plan. So in each of the 5-year plans, the planners keep certain targets, certain priorities, and as social workers we need to have first-hand information about this planning process, the kind of programs that are there within a particular 5-year plan. Because as social workers, when we work with the people in the society, we are basically addressing their problems. And while addressing their problems, we should also be able to tell the people the kind of efforts that the government is making to alleviate from their situations, whether it is social or economic. And so, to discuss this issue or this aspect of social welfare programs in the 5-year plans, which is given in the Block 2, Unit 3, I have with me Mr. Gurupada Soren, who is a lecturer in School of Continuing Education. He has extensive experience, especially in the area of social welfare programs. Although he is a teacher today, he has also worked very much with the NGOs across the country, and he has a lot of experience, and he will be an asset to us in this session, and he will tell us more about it. Now, to begin with, I would request Mr. Soren to speak to us about the need for social welfare in India, as well as who are the beneficiaries of various social welfare programs. Mr. Soren.
Thank you, Professor Thomas. Since our independence, the India has plenty of programs for the welfare of the weaker section, especially women, children, minorities, scheduled caste and scheduled tribes, for the betterment of their standard of living. In the Constitution of India, it is clearly been enshrined in the fundamental rights and directive principle. As long as the weaker section of the country is existing, the nation cannot be developed. As a result, the Government of India has taken initiative to develop various programs for the weaker section, especially women, children, physically challenged, mentally challenged, minorities, blind, orphanage, and recently the problem like prostitute, drug abuse, alcoholism, these are arising recently. So the social worker has a responsibility to intervene with the resources from the government as well as from the community. So the Government of India has a plan since its inception of the Planning Commission, the welfare of the weaker section for their betterment of their standard of living, their education, their health, and overall development of the weaker section. However, the social worker, especially the professional social worker, has a responsibility to make the government in policy level about the various problem and how the intervention can be done. So these are the main weaker section or beneficiaries of the Planning Commission welfare programs. Besides this, in general, the Planning Commission has also the responsibility to develop the nation. All the people of India are the target groups of these social welfare programs.
Well, when we talk about the social welfare programs, and you have also mentioned about the kind of beneficiaries of these various welfare programs. Now, we do talk very much in a democratic country about the need for democratic participation of people in various developmental programs. Now, how can democracy and people's participation in a development process play a role for the betterment of the people? Can you highlight on that particular aspect?
Yeah, like country in India, we are in the process of developing. That is in the period of transition phase. To implement the democracy where people can participate for themselves, for their betterment, their decision making, they have to involve in policy level as well as in implementation level. From our global scenario, we have experienced that 80% of the resources have been enjoyed by the 20% of the people, and rest 80% of the people, thus they are getting 20% of the resources. So we can easily identify how the problem arises and how the weaker section have been deprived of the resources. Though the human rights and the Constitution of India clearly enshrined for equal rights for everyone as a human being, but in reality it is not so. Therefore, the democracy has to be promoted. The people have to participate for the development, that is in the planning process, to make decision about themselves. What are the policies are being taken for the betterment of themselves? Until and unless they will participate in the planning phase, implementation phase and evaluation phase, it is really difficult to get the opportunities for the development of themselves.
Well, when we talk about say opportunities that are being given for the people, say 5-year plans do have certain objectives. Each 5-year plan keeps certain objectives. Now, it would be nice if you can share with our students about the objectives that are there for the 5-year plans, and in particular the various kind of programs that are there for the welfare of weaker sections, because social workers are working with the weaker sections primarily, especially working in the villages and the slum communities. Therefore, addressing the problems of the weaker sections is very important, and majority of the students who have joined our programs are from the rural sector and the tribal sector. Therefore, information about the welfare programs for the weaker sections as well as the objectives of the 5-year plans would be of great benefit to our students. And therefore, Mr. Soren, can you highlight on those two aspects for the betterment of our students' knowledge?
Yeah, as far as the objectives of the Planning Commission is concerned, it is main objects to develop the nation, and the nation cannot be developed just in the planning phase. Whatever the planning is going on, it has to be implemented for the target groups, and the target groups has to realize these are the programs meant for them, and how this program can reach them effectively for the betterment, so the nation can be developed. Besides the development of the nation, there is a program for economic development program. They have to be economically better up to get the better education for themselves, to get the better health infrastructure all over the India, not like in metro. Wherever they are residing, they should get the facilities of the health. Otherwise, it is really difficult for the development of the nations. To mobilize the various resources available of the government and how to reach these resources to the beneficiaries. This resource cannot be just sent to them, or just they cannot be or they cannot receive just it has been planned. Through this process, the resources has to be utilized properly, whatever they are getting, or in the main, or the system cannot reach the beneficiaries for their betterment. So these are the main objectives where Planning Commission play a vital role for the development of the nation, development of the weaker section, so that ultimately the goal, development of the nation, can be achieved through the process.
Well, you have said that securing increase in the national income, mitigating the inequalities of income and wealth, also trying to promote the agricultural production, trying to help people, especially the weaker sections and the backward communities, to address issues and to mitigate their own social and economic betterment. Now, one of the important aspects when we talk about weaker sections is about the nutritional aspect, because unless people are fed well, unless they are able to have good health, they will not be able to perform well and be a good source of production to the nation. So can you highlight on the importance of nutrition for weaker sections, vis-a-vis its importance in national development as a whole?
Yeah, nutrition play a vital role for the national development. It is an indicator for the economic growth, for food adequacy and their distribution. When the weaker section cannot get the proper nutrition, they cannot think for the betterment of themselves, or they never can think about the development of the nation. There are plenty of resources, just they have to make use of the resources and how to utilize the resources from the government sources, from the community's resources, and from other benevolent agencies where they can make use of these resources. So the nutrition is an indicator of the national development for the betterment of the weaker section.
You could also perhaps highlight on the other welfare programs apart from nutrition alone. A lot of other welfare programs are there, and there are various ministries which are coming out with the welfare programs both at the national level as well as at the state levels. Can you throw some light on these various welfare programs?
The mainly other welfare programs include the minorities, where they are deprived of their basic rights. When they are staying in the community with a dominated community, in their respective community they are depriving of their basic right. Like whatever the resources they have in the community, they are not getting the resources. The dominating community, they are dominating over the resources, and what already I have mentioned, 80% of the resources are just enjoyed by the 20% of the people, and rest 20% resources are really scarce for the rest 80% of the people. Besides this, these physically and mentally challenged people also get the same fate whatever they are facing, like in weaker section. And these are the main other welfare programs where the Planning Commission has a role to play for the development of the nation.
Well, when we talk about planning, we have two layers. One is at the center with the central government. We have a National Planning Commission there. Then we have planning commissions in various states. So the state governments know their locally specific needs. They know the kind of financial allocation that is given by the Central Planning Commission for each state. So based on those financial allocations, each state government makes its own plan for their state. These are locally specific. The kind of plans that are being prepared by the states in the south of the country need not necessarily be the same when we make plans for the welfare of the people in the northeastern states, which is predominantly tribal. Same way, the kind of plans that are being made in a state like, say, Madhya Pradesh may not be the kind of plans that are needed for states which are bordering the international boundaries, where the needs are again something different. For example, we know very well that people living, especially in the border areas, do have problems of insurgency, we have problems of drug trafficking and a lot of other international problems of people crossing over the borders and creating problems also of defense and security of the country. Therefore, the needs of each state varies. The center prepares a plan for the entire country. The state makes plans for each specific state depending upon the kind of need of those states. Now the thing is that whenever we go for making a set of plans, in our policy formulation, we do have certain strategies. And to think about the strategies is something very important. So I would request Mr. Swaran to talk to you about the strategies, particularly in the 9th 5-year plan, that will help us to understand the importance of strategies and the kind of strategies that are there, especially while preparing the 5-year plans. Mr. Swaran?
The 9th 5-year plan from 1997 to 2002. It is the end of the century and beginning of the century. So the government of India also planned plenty of programs, and based on that the study has been taken. Like multi-sectoral community-based rehabilitation for the disabled, where the disabled can be empowered for the betterment of themselves, where the government resources can be allocated for themselves, for the disabled people. In country like India, old age is also a problem. So old age, for the take care of the old, the National Institute of Social Defense has been set up for the betterment of the old age, for their recreation, for their health, for their shelter, and for their various vocational training, where they can be engaged for the betterment of themselves. Besides, special attention has been paid to the welfare and development of the scheduled caste and scheduled tribes, to mainstreaming for the national development in India. Besides this, the special programs like juvenile delinquency, children, drug users, alcoholics, they are also covered in the whole programs. Besides, the street children is a problem. Street children is a big problem in places like metros or township. So the government has planned for their education, for their health, so that they can be developed as a better human being for the national development in India. Besides this, various voluntary organizations and corporate institutions also encourage to participate in the developing process so that the India can be developed within this period. However, the government of India planned the various welfare programs, and based on the program, the strategy has been taken for the implementation of these programs.
Well, among the many programs that are there, one is concerning the empowerment of women. So many programs are going on across the country for the welfare of the women, and the main focus of most of these programs are to empower the women so that they are able to become economically independent. They are able to improve in their knowledge base through the educational process, getting them admissions, opening up schools across the country, into the villages, into far-flung areas, and providing them whatever assistance that the government can have, like the free ships, midday meals, and lot of such welfare activities or services are there that have been extended for the welfare of women. Now, one of the important aspects nowadays we talk a lot about is the self-help groups. A lot of money is being pumped into promoting this particular aspect of self-help groups, so that women are able to form themselves into groups, particularly for the purpose of economic betterment. Now, when you go into the villages, when you go into the slum communities and make family visits and talk to women within the families about their own various problems, this is one of the ways in which students of social work can make a kind of entry into a particular community, talking to them about their own social situations, the kind of day-to-day problems that they face, social problems, family problems, economic problems, emotional problems, health-related problems. All these are aspects of concern of women, whether they are in the rural or the urban sector. And when we talk about the very concept of empowerment, what's the need of this empowerment? Why do we give so much of emphasis to women's empowerment? Is there a need for giving empowerment to women? There is also a debate going on even in the parliament about reservation of a certain percentage of seats in the elected bodies of the government. All these are activities for the empowerment of women, and perhaps the aspects of empowerment of women in the 5-year plans are there, and I would request Mr. Swaran to speak to you about the various aspects, in particular relating to women in the 5-year plans of especially in the 9th 5-year plan. Can you talk about? Yeah,
the empowerment of women is the strategy they have taken in the 9th 5-year plan. But from the very inception of the Planning Commission, the Government of India has tried to develop the weaker section, that is mainly women and children. And they have adopted the approach of welfare, especially first, second, third planning, third year of 5-year plan. Mainly the Government of India has concentrated on welfare of the women. So they have developed various programs for the welfare of the women. And in the process, they have reviewed ultimately whatever the target they have taken, somehow it could not reach. So that Government of India changed the strategy. Then from welfare to the development for the women. Again, the expert, they realized no, the development cannot be done for the government through the government machinery or the voluntary organization or corporate sector. So they thought that there is need to empower the weaker section, then only the development can be achieved. To help the weaker section to participate in the process through which they are being involved for the development of themselves. Especially in the 9th 5-year plan, the government have especially emphasized on the empowerment of the women, like Rashtriya Mahila Kosh in the central level, and in NGOs also, or in community level, the self-help group is also promoted to take the own decision for the development of themselves in policy level, and how to implement the policy they have taken in the development process. And not only that, to evaluate whatever the program was going on and how it can be achieved, or what are the mistakes they have taken, what are the mistakes they have done in the process of implementation. So it can be corrected and again implement for the betterment of the women. And these are the women, and beside this, the children also cannot be deprived, because children, they cannot ask for their rights. So the Convention of Child Rights, which ratified in 1992, and based on that, the Government of India has taken a policy for the development of the children. And in that program, like the Integrated Child Development Scheme, through the Anganwadi Center, where the children can be looked after for their better nutrition and to make them ready for the school. Nutrition as well as the providing education through which they can concentrate on education, which will help for the development of the nation.
Well, when we talk about the development of the nation, we are talking about the kind of contribution that women make in their household front. We do have the annual budget which is being presented in the parliament. We do talk about the kind of various programs or strategies that the government of India has for the development of the nations through various sectors. However, one important aspect that we keep on missing is a kind of contribution, especially the kind of economic contribution that women make. As we all know, almost 50% of the population of the country constitute the women, and their involvement cannot be ignored when we talk about or discuss about the developmental issues. All this for a social worker is talking about the basic unit of the society, what we call the family. And family consists of the man and the woman and the children. And it is a woman who is actually planning the various programs within the family for its own welfare. It is she who bears the children, takes care of them, their physical requirements, their social requirements. In case of illnesses, again it is a woman who is there to take care of not only the child but also its siblings as well as other members in the family. Same way, preparation of food at home, taking care of the household requirements from early morning late into the nights. She spends endless hours working for the betterment of the family and its members. Now, if that amount of time is being spent in an employment sector, that gets highlighted because she is being paid for that in terms of money, whereas at home she is not being paid for that, and therefore the amount of contributions that she makes does not get reflected. The simple way of understanding this aspect is to employ servants at home to take care of various requirements. It may be for washing the utensils, you have to pay separately. Cleaning the house, dusting the house, you have to pay separately. Taking care of the laundry, the linen at home, cleaning it, getting them pressed and ready for wear, you pay them separately. When a child is sick, you employ somebody to sit near the child and pay to the servant for every day the number of days that a person sits with the child once a child is sick. You pay for that. If the child is to be taken to a hospital, you need to hire a vehicle, you need to have somebody to accompany the child, keep company with the child or any member of the family who is sick. And if you have to pay, then you can calculate and find out in a month how much money one has to shell out to keep the family together. Now, in most of our Indian families, we fail to recognize the kind of contribution that the women are making, and that we can realize and recognize and understand if we can make the kind of a calculation for every bit of work that is being done. For example, cooking. She does the cooking in the morning, afternoon, evening to keep the family healthy. And these are important aspects which have been simply forgotten. And then when we talk about the amount of property that a woman owns in this country, it is less than 2% of the total wealth of this nation. Whereas we depend on the woman for our full development, whether it is national development or the state development, the development of a particular community or a society, and for that matter of a particular family and individuals within the family. And we always fail to recognize that. Same way, the needs of the children too are important. Children become sick, they need to be taken care of, they need to be sent to education institutions for their studies, they need to be assisted during their studies, they need to be given sufficient environment, adequate environment for their all-around growth. So all these, again, the woman contributes to a great extent. Now it's important that when we do the planning in any government, whether it is center or the state, we give due emphasis to the kind of contribution that the woman makes and the contribution that a child today, which is the next generation in the offing, who needs to be taken care of. Therefore, planning also has to keep in mind the importance of providing maximum that are required for the welfare of children. So these are the two important aspects one needs to keep in mind. And there are certain other issues that needs to be addressed when we talk about women and children in the planning process. And I would request Mr. Soren also to talk to us about the care need to be given for the physically and the mentally challenged especially in the planning process, what is the need for giving emphasis to the physically and the mentally challenged, the physically disabled or the mentally disabled?
Yeah, physically challenged and mentally challenged, they are really weaker section in physical terms. Whomsoever, anyone can recognize that he or she is mentally or physically challenged. So the government of India, during the 10th 5-year plan, they have taken certain policies to take care of them. For the development of them, the how to help these physically and mentally challenged for self-reliant, for various vocational training through which they can increase their income so that they don't have to depend on their family members. Besides, they have to be active, and they are also equal rights whatever the Constitution of India or human rights have enshrined in the respective articles or constitution. So the government is trying to help them for self-reliant, active participation in the planning process for themselves, and how to become the member of productive contributors for the development of themselves as well as for the nations.
See, another aspect in the planning process is of the aged people, what we call the old people or the senior citizens. The senior citizens are an important component. They have made a lot of contribution to national development, and they cannot be forgotten. So I would request Mr. Soren to tell us also about the importance of planning for the aged in this country. Mr. Soren.
Yeah, for the aged, the main problem they are usually faced is health. Besides, shelter, vocational training, and the recreational facilities for themselves. And recently, the Autonomous Institute, the National Institute of Social Defense, has been set up to strengthen professionally, technically, financially for the betterment of the old age, which can help for the development of the nations.
Well, students, you have seen that during the last 42 minutes or so, we were discussing about various components of social welfare program in our planning system. We spoke about the planning commission at the center as well as at the state. We have also spoken about various aspects which are there within the planning strategies that are required for planning, the components that are there, and some of the socially and economically disadvantaged groups, particularly the women and the children, along with the disabled and the aged, who needs special attention in the national importance for national development. Now you can read through the third unit in block 2 of PSWE 001, which will give you a lot of information about social welfare programs in the 5-year plans. Thank you for attending this particular session, and we shall be back with you after 15 minutes. And I thank all of you who are present at various regional centers and study centers attending this program. Thank you.